The elasticity allows arteries to absorb pressure waves that come with each heartbeat. The contractility, arteries can change in diameter, and they're controlled by the sympathetic division of the autonomic nervous system. So the sympathetic is also known as the branch of the autonomic nervous system, which comes into play when we have had a fright or we need to get away quickly, called flight. So sympathetic is involved in fight and flight, whereas the parasympathetic is involved in rest and repose. So if you can remember that, that'll help guide you as to what's actually happening when the sympathetic innervation is occurring in the blood vessels. So vasoconstriction, when the blood vessels get smaller, the contraction of the arterial smooth muscle is again controlled by the autonomic nervous system. Vasodilation is the relaxation of arterial smooth muscle, and it causes the lumen, the inside diameter, to increase. If we've got changes in the size and diameter of the blood vessel, that will of course affect the afterload on the heart. So remember when we spoke about afterload back in the heart lectures, we said that afterload is anything that affects the heart after the blood leaves through the systemic circulation. So if you can imagine that the ventricles are pumping, but if the tubes on the on the side where it's pumping to are larger, then the afterload is going to be reduced. Also, on the opposite, if the heart is pumping and the blood vessels are all constricted, then it's going to cause more pressure or an increase in afterload. Peripheral blood pressure will also influence, is also influenced by vasoconstriction and vasodilation, and vasoconstriction and dilation will also affect capillary blood flow. Arteries travel away from the heart to the capillaries, and where arteries exchange. And there are arteries, if we're moving down from the largest arteries, so from the aorta we move to the elastic arteries, the muscular arteries, to the arterioles, then we move to the capillary bed. So of course we're moving from largest to smallest. So the elastic arteries are what are called the conducting arteries. These are the large vessels such as the pulmonary trunk and the aorta. The tunica media has elastic fibers and few muscle cells. The elasticity evens out the pulse force. With the muscular arteries, they're called muscular arteries because most of them have they have the highest amount of muscular cells, and these are all the distribution arteries. These are medium-sized arteries, and these account for the majority of arteries in the body. And the tunica media, the middle layer, has many muscle cells. The arterioles are the smallest of the arteries before we get to the capillary bed. They have little or no tunica externa, and they have thin or incomplete tunica media. So you can see that we're getting less and less muscle around the arterioles, moving down, getting smaller and getting thinner until we get to the capillary bed. So artery diameter, the smaller arteries and the arterioles, they change with sympathetic or endocrine stimulation. So sympathetic, remember that's the autonomic nervous system. And when we're talking about endocrine, we're talking about hormones. Hormones, of course, are chemicals that other organs secrete into the blood supply, and that can affect the diameter of the artery. One that comes to mind, of course, is adrenaline. And if arteries are constricted, they can oppose blood flow. If they constrict, then they cause an increase in resistance. And resistance vessels, they're also the arterioles. So we're slowing the blood down. So here's a diagram showing you on the one side what is predominantly blue on the diagram on the left side, and on the right side what is sort of the pinky colour. So that's to represent, of course, the veins on the left as we're looking at it, and the arteries on the right. You can see there that the diagrams go from the large veins and the elastic arteries, and they correspond then to the medium-sized veins and the muscular arteries, the venules and the arterioles, and then we move down to the smallest and the thinnest of the vascular bed, the capillaries. There are different types of capillaries that we're going to talk about in a minute. We've got fenestrated capillaries, normal capillaries, and then continuous capillaries. This is what happens when you get a build-up of plaque. Remember, plaque occurs in the tunica media, where you get a large atheroma developing in a condition called atherosclerosis, and you get the plaque depositing. The consequence of that, of course, is that the diameter, which you can see, excuse me, I've got a frog in my throat today, the tunica externa, the diameter should be as wide approximately as the tunica externa, but because of the plaque deposit, the actual channel with which the blood can flow through is restricted by probably down to a quarter of what it should be, or even less. So this is a coronary artery. So these are the arteries that supply blood to the heart muscle itself, and these are located on the surface of the heart. So if a person had a coronary artery with this much of the plaque deposited, you would expect that they could be experiencing that symptom called angina pectoris, or chest pain, because the muscle distal to this blockage in the artery is experiencing what is called myocardium. So the muscle heart is experiencing ischemia, lack of blood supply.